Thank you very much for joining me. In the midst of climate change and all of the incredible devastation it is causing in our country and around the world, in the midst of unprecedented income and wealth inequality and a growing gap between the very rich and everyone else, in the midst of a corrupt political system dominated by billionaire campaign contributors who believe they have the right to buy and sell politicians, in the midst of right-wing efforts to undermine our democracy, and so many other issues, there is one major issue that I hope does not get lost in the shuffle, an issue that we have got to continue to concentrate on because it is life and death for so many Americans. And that is that almost everyone in our country understands that our healthcare system is broken, it is dysfunctional, and it is getting worse. A rational healthcare system is one that guarantees healthcare to all people as a human right. Our system is designed to make as much money as possible for the insurance companies and the drug companies. And that is the fundamental reality of our system. And the result is that today we spend almost twice as much per capita on healthcare as any other nation. Nearly $13,000 for every man, woman, and child in this country. Really quite incredible. And we spend an unsustainable 18.3% of our gross domestic product. Yet, despite all of that spending, we remain the only major country in the world not to guarantee health care to all, leaving 85 million Americans uninsured or underinsured. And as many of you know, that number has gone up recently as millions of our people have lost the Medicaid coverage that was provided to them during the pandemic. Despite our huge healthcare expenditures, again, almost twice as much as any other country on earth, our life expectancy, how long we live, is considerably lower than almost any other wealthy nation. And in many parts of our country, life expectancy is actually getting lower because of opioid addiction, because of suicide, because of inadequate health care and everything else. And incredibly, the gap in longevity, how long we live, between the rich and the poor in our country is now at least 10 years, as tens of thousands of Americans die every year because they can't access the health care that they need. In America today, we pay by far the highest prices in the world for prescription drugs, while the pharmaceutical industry reaps huge profits and pays their CEOs exorbitant compensation packages. 1 out of 4 Americans cannot afford the prescriptions their doctors write. Further, one of the major causes of the escalating cost of hospital care and insurance premiums is that many of the new drugs coming onto the market for cancer and for other diseases now cost over $200,000 a treatment. You got that? $200,000 a treatment. And as bad as our overall healthcare system is, and it is quite bad, our primary care system is even worse. Today, we have a major shortage of doctors, nurses, mental health providers, dentists, and pharmacists. And those shortages will only grow as a result of the COVID burnout that many providers experienced and the aging of our healthcare workforce. As a result, tens of millions of Americans in every part of this country, even those with decent insurance, cannot find the medical care they need in a timely basis. Some Americans have to wait months to get a medical appointment. Others have to travel long distances to find the kind of doctor they need. According to the most recent estimates, over the next decade, our country faces a shortage of over 120,000 doctors, including a very significant shortage in primary care physicians. The nursing shortage may be even worse. Over the next 2 years alone, it is estimated that we will need between 200,000 and 450,000 more nurses. We also have a major shortage of 100,000 dentists in America. And despite the very serious mental health crisis we are facing, there is a massive shortage of mental health service providers, and that is psychiatrists, psychologists, social workers, counselors, addiction specialists, and many more. Further, our home healthcare workforce is also totally inadequate. Now, here is something that's really interesting and kind of explains why we end up spending so much on healthcare. Most countries spend between 10 to 15% of their healthcare budgets on primary healthcare. Canada spends 13%, Germany spends 15%, Spain spends 17%, and Australia spends 18%. We spend less than 7%. In other words, we spend less than half of what other countries spend on primary health care. So it happens that instead of investing in disease prevention, in keeping people well, and enabling people to gain easy and timely access to the medical care they need when they need it, what do? We kind of ignore those issues, and then we spend very heavily on hospital and tertiary care, and we force people with very common illnesses to go into emergency rooms because they have no other alternative, at a time when emergency rooms are by far the most expensive form of primary care. The result is that every major medical organization in the country, no matter how conservative they may be, understands that what we are investing in primary health care is woefully inadequate. They understand that focusing on disease prevention and providing Americans with a medical home will not only save lives and ease suffering, it will save billions and billions of dollars. Providing primary care to all is not only smart health care, it is cost-effective health care. As chairman of the U.S. Senate Health, Education, Labor, and Pensions Committee, called HELP, I am working hard on bipartisan legislation that will begin to address some of the healthcare crises we face. Not all, but some. Legislation that I'm working on, if passed, would be an important step forward toward a more humane and rational and cost-effective healthcare system. And this is what that legislation contains, among other things. Working with the Senate Finance Committee, we would significantly increase the number of doctors in our country by greatly expanding the graduate medical education program, residency program. We would also expand the Teaching Health Center graduate medical education program and the National Health Service Corps. The goal of all of those programs is not only to increase the number of doctors we have, but to focus on primary health care and placing physicians into medically underserved areas. We would also provide incentives to those medical schools that are focusing on graduating primary care physicians. So the goal here is, yes, we need to increase the number of doctors we have, but we need to focus on making sure that those doctors are primary care physicians, general practitioners, people out in the communities, and also that those doctors go to the areas we need them most. And that is often underserved rural areas and urban areas as well. Furthermore, we would greatly increase the number of nurses that we need by expanding programs that address the shortage of nurse educators. And let me mention something to you that is really quite incredible and really speaks to the dysfunctionality of the current system. Unbelievably, in the midst of a massive shortage of nurses, the American Association of Colleges of Nursing tells us that U.S. nursing schools turned away over 91,000 qualified applicants in 2021. So here we have a major nursing shortage. Hospitals are spending a whole lot of money on what they call traveling nurses. Patients are not getting the care they need. And yet, nursing schools are turning away qualified applicants. Why is that? Because they lack a sufficient number of faculty, and they also have inadequate physical infrastructure in order to train their nurses. So it's not complicated. If you have more faculty, nursing schools will be able to expand. That's for 2-year nursing schools, 4-year nursing schools, and that is what we have got to do. We're going to increase the number of faculty and the physical infrastructure of nursing schools. Further, our legislation would expand primary care by growing the number of federally qualified community health centers, FQHCs, that now provide primary health care to some 30 million Americans. You may not know it, but there is a community health center probably not far away from where you live. And the beauty of these community health centers, significantly funded by federal money, is that not only do they provide primary health care, they also provide low-cost prescription drugs, as well as dental care, and dental care is a major crisis in this country, as well as mental health care, something that in many parts of this country we are in desperate need of. So this bill would increase the number of these community health centers throughout the country, concentrating on rural and urban areas which are now medically underserved. The result, if we can get this legislation passed, is that millions more Americans would be able to receive the primary health care, and that means dental care, means mental health counseling, means low-cost prescription drugs. They will be able to get that care in a timely and cost-effective way. Now, I don't have to tell any of you that year after year, politicians have been talking about our healthcare crises. Well, the time is now to end the talk. The time is now to act. Let's do it. Thanks very much.